Hi, I'm André Fallot. I'm the medical director of the Pediatric Intensive Care Unit at the Children's Hospital at St. Francis. I decided to become a physician originally because of my grandfather, who had been dying of cancer. That feeling of helplessness over time ate at me, and recognized that just when you feel helpless, whether it be our own child, our parent, other loved ones who are in the hospital, we have no control. Over time, realized that feeling helpless doesn't mean that you need to feel hopeless. So that put me on my path into medicine, and then more specifically into pediatrics, where it's hard to have any better role model when you see the statue of Jesus as you enter the children's hospital, to be able to have a heart of a child and a special place in his heart for children, knowing that if they present to you an extreme illness, they're really sick and need your help, and that I'm drawn to that. Pediatric critical care physician in an intensive care unit concentrates specifically on children who are incredibly ill. Either their lungs aren't working, or their heart is failing, or their kidneys are failing, or they just simply can't breathe. We're there to help them breathe. We're there to be able to give them the nutrition they need, to be able to give them the IV fluids they need, but a higher level of care than any traditional hospital can do. So to be able to put a breathing tube into their windpipe and have a machine breathe for them, have them comfortably sedated, being able to give them medications to be able to have their heart work better, and if need be, even put them on either dialysis or even cardiopulmonary bypass, something called ECMO, to be able to help support them while they're getting through their illness. And at the same time, essentially treating the families by being able to let them know exactly what we're doing and reassuring them during this feeling of helplessness that I described earlier, and to be able to ensure that they have hope where we can, and to be able to get them through their darkest times is the entire reason we exist. My treatment philosophy overall in working with staff or families is to be as collaborative as we can. Everyone on the team, including families who know their children better than anybody else, and use the best evidence to be able to work together as a team, which I believe is a verb, to teaming, and ensure that we all collaborate to lift each other up, and most importantly, lift our patients and their families up. In pediatric critical care, we have to take the full spectrum of children from being just born and have left the neonatal ICU, or only a few weeks old and come in through the emergency room, all the way to 18 years of age. So sometimes that means children who are born with different genetic disorders, juvenile diabetes, all kinds of other disorders that often need chronic medical care, versus healthy children that suffer accidents, whether that be a fall, whether that be just a brand new illness with RSV after they've been completely healthy. So often families are caught completely blindsided and are even more frightened because of that. Their previously lovely, healthy child is now critically ill. And we need to approach that to be able to say, okay, here's where we're at, here's where we want to go, and here's what we need to do to get there, and here's what we propose, and here's why. Families are super savvy and know what works for their kid and what doesn't, what approaches are helpful and what's not helpful. And so we can rely on them as really knowledgeable team members because they're the subject matter expert for their child. When I had a chance to actually visit the Children's Hospital and to see how impassioned our nursing staff are, physicians that I got to meet, and just as importantly, administrators that I got to meet, that everybody in a mission-focused and mission-oriented hospital where we can all get behind the same purpose is rare. To have a calling and a cause that's shared by everyone, that we can point in the same direction to lift our children up and to be able to heal them in that environment. Sorry, it makes me emotional. It's one of the reasons why I left Washington, and that this type of environment's rare. And I'm excited to be here. I'm taking care of patients full time, in addition to being the medical director. And I love it. It's why I do what I do and never went, even though I've had organizational leadership roles within the military, I love patient care first and foremost, which is why I haven't left it.